I love what I do because I believe that in the work with diversity, equity, inclusion, that in this role I'm able to create space for everyone, to provide that platform to allow everyone to have a voice.
Nursing is a tremendously challenging profession, and so it is imperative that we all promote these activities of self-care.
We understand barriers that people see in the community to be healthy, and we bring that forward to our practices.
What I'm passionate about is how we can optimize evidence and leverage evidence to improve the lives and health of patients.
Nursing colleges must support research if we're going to advance in our discipline.
We know that nursing is an important profession. We give back, we help people, and we give voice. And that's what advocacy is, giving voice to good health policies. BREATHE is bridging research efforts and advocacy toward healthy environments. And our work, of course, has been in smoke-free policy, outcomes research, and tobacco-free research. I think we've played a huge role. The College of Nursing has taken a leadership role on campus and when it comes to policy advocacy.
The way that we think about global health is we think about going somewhere else to serve and utilize our medical skills and try to improve the health of communities. And then the other component is going to places where we're learning from what they do well so that we can apply that to the health of Kentuckians. Dean Heath has been instrumental to our community health and public health work with our students in that she is always championing our work.
So it's one thing to talk about diversity, equity, and inclusion, but really the effort and the outcomes are related to what we do. And so Dean Heath has been very committed to bold actions in this space for diversity, but also to hear different worldviews. Together, we're stronger, we're better.
She is just a tremendous role model for leadership and innovation and creativity and practice and education, research, all of it. We've seen that here at the college, we've seen it at the national level, and I think that's the legacy that she leads.
She is a servant leader, so she leads from the front. She joins us on HCATS. HCATS to Appalachia was our program where we worked with the College of Dentistry, and she was on the ground with us and then comes back and makes sure that we have the funding to keep doing it.
In that respect, Dean Heath has worked very closely with different colleges and across the different disciplines, especially the healthcare colleges, to make sure that the work we do is well represented.
Nurses give voice, and we do that with patients at the bedside, but we also give voice for rules or policies or laws that will impact our health. And I think the College of Nursing has taken a strong role in that way, and to protect the health of citizens and to support nurses.
Dean Heath has really helped to be a visible presence and a voice for nursing at the university. She's really well respected among deans. You've got such a cheerleader.
I've been able to really pour my heart and soul into what I've always wanted to do all my life, and I absolutely have been able to do that as a direct result of Janie Heath's mentoring. Across the whole college, faculty, staff, our students, everyone is in a much better place with their mental health and well-being as a direct result of Dean Janie Heath's passionate support of practices of resilience. We were the top leading scorer for work-life engagement and wellness at the University of Kentucky.
What we've done at the College of Nursing, the increase in our research portfolios, the increase in the national awards we've been receiving, have been in large part to Dean Heath and the senior associate deans.
One of the other things that Dean Heath has done in the DEI space is the creation of the Fab Five, the creative way to create space to acknowledge those individuals. And what an interesting platform, a way to acknowledge people and their accomplishments and achievements. What that resulted in was the creation of a scholarship fund and to create avenues to benefit people from all backgrounds, to come to school to become nurses.
We are engaging in state-of-the-art technologies and teaching and research and practice. I see that continuing, beyond Dean Heath's tenure here.
So as the first African American DNP graduate in the nation, really, and from the College of Nursing at UK, what that has shown to me is the propensity of the college to grow and to be better and to move in spaces that other people haven't been in. And so I believe that in the work with diversity, equity, inclusion, the dean has set the stage and opened the door for us to be very broad in our thinking, but even more broad in our actions.
She's created so much energy and passion, and she's definitely built amazing relationships, both within the College of Nursing and beyond. We will take that energy and translate it and transform it into something even bigger and better.
We're also getting the national recognition that we need to attract even more seasoned researchers so we can diversify our portfolio to move forward in the whole agenda of nursing science.
The 8 years that she's been with us have been tremendously growth producing. We are in such a good place to be able to move forward with the policies and the programs that she's set in place, and we're going to go out there and get them.
So when I think about her leadership style, I'm reminded of a quote from Simon Sinek. And Simon states that a good leader inspires us by what they can do, but a great leader inspires us by what we can do. And Janie has done nothing but that. Now that she's established the platform, she's opened the door, and she's passing the baton to this work. It's imperative that we take the baton and continue this work, because we still have lots of things to do and to be very confident in what we can do and achieve together. And the sky is only a view, not the limit.